I'm Andrew Austin, and this is the Freedom and Reason podcast. Hey, how are you doing? I wanted to come back to this COVID-19 story. I don't mean to look obsessed by it, but I think we can see that just about everybody is. And there's so much, there's a lot of false information out there. But I think more insidious is the failure of the government and governments and reporters who are just scientifically illiterate. They do not understand basic science. But it's surprising to see that governments are doing a really poor job of this as well. I want to note before I start, you can see I have blackout curtains here, but the sun is very bright today. And so as soon as I finish talking to you, I'm going to go out for a walk. I live in Wisconsin, up in Green Bay, and a good chunk of the year it's very cold, and so when spring gets here, it's quite a joy. The other thing I want to point out is, and I think I probably said this before. Certainly, I've said this in various communications that I have. With my students, because now that we're in lockdown, having to do a lot of podcasting, if you will, my lectures and communications to students, that I do suffer from allergies, spring allergies, very badly. And today, given it's a bright sunny day and the wind is really whipping out there, they find their way into my house. Okay, so on with the show. The Globe and Mail has a story out. I think this came out yesterday morning. I read this, and the title of the story is scary. Who sees little sign of herd immunity? And the line that's the important one in the story, in my view, is that, quoting from the story, even if antibodies were effective, there was little sign that large numbers of people had developed them and were beginning to offer a so-called herd immunity to the broader population. Now, as I discussed in my podcast over the last several days, and in my and on my blog, we don't actually know who's been infected because we're either not testing or we're not applying the epidemiological modeling used to estimate flu-like illnesses. So as for herd immunity, if it were true that our immune systems did not develop antibodies for the virus, then how was a vaccine supposed to work? So that was something that I had posted on Facebook in response to this, because what I use my news feed as a news feed. And so what I do is I share stories and then I have commentary on them. Facebook, occasionally I share things of personal nature and maybe a meme here that's funny or whatever, but most of what I do on Facebook is commentary, discussion, and news feed. Seems to be the most useful way to work on Facebook. Okay. And by the way, for those who are friends with me on Facebook, and there's quite a few of you, if it's annoying, as I like to say, you can always you don't have to unfriend me. You can just take me out of your news feed, and then you can unfollow me, and then you don't have to read the things I'm saying. It's funny how people seem to feel like because you're saying something publicly, they're forced to listen to it. In any case, that was what I said, and so this is a very dismal prospect. So here we are. We have these viruses. We develop antibodies to them. They're RNA viruses. Our immunity slips away more quickly with those principally because RNA viruses mutate rapidly. So this is why we really can't achieve herd immunity for the viruses, rhinoviruses, coronaviruses, and influenza viruses that circulate every year. We can develop immunity for them, but nowhere near the immunity, the herd immunity that we've acquired over years from things like measles, for example, which is a DNA virus. Now understand that the headline was based on a claim by the World Health Organization, and I say this charitably. This is an organization that's been asleep at the switch while the virus is spreading. And, the New York Times came out and tried to defend them, and Noam Chomsky it has gone on this yellow peril rant about how U.S. government is blaming the WHO and blaming China for this virus to deflect from their own failures and making it all about our racism and all of that. Noam Chomsky's it's terrible to say, but his credibility. Then this is a guy who now for years and years has been making the lesser of two evils argument. That it's the moral obligation of every person to vote for the lesser of two evils. And contradicting his own arguments over the last several decades. In any case, I mean, the point about being asleep, and I said that charitably, but let's be more serious about it. This is what happens when you put an organization in the hands of third worlder who is a member of, more than one Marxist-Leninist organizations. I mean, organizations with names that sound like joke names from Monty Python's Life of Brian. In any case, so let's get to actual scientific thinking on this matter. So keep in mind that the vaccines are at best 40% effective against influenza. Those are the industry studies. So we depend on those who've acquired immunity from contracting influenza to raise that percentage. I've already made this argument. At the same time, we have tens of millions of flu illnesses this season. So we can't be anywhere near herd immunity for influenza. And this has resulted in 24,000 people dying from influenza. In 2017-18 flu season, 60,000 people died. So the flu is killing tens of thousands of people every year. Sometimes less than 24,000. This has been not a particularly bad year, but it's been worse than other years. 2017, 2018 was particularly bad. 2009 was bad, right? And so on. But the fact is that we may not ever achieve herd immunity to RNA viruses like coronaviruses, influenza viruses, rhinoviruses. This is why the cold is so common. That's why we call it the common cold. I've had numerous colds over my life, and I've had numerous cases of the flu, not as many as the cold. Here I am. So perhaps when I suggested this on Facebook, perhaps we need to examine more closely the tragedy of things entering into our consciousness, things that may be largely beyond our control, or things that we have, for millennia accepted as part of life. Getting sick and possibly even dying is part of life. So this episode indicates, among other things, that a change in mass consciousness has made populations acutely afraid of nature. What has been called a cult of safety. So anyway, fortunately, the WHO is wrong. There are antibody tests, and they back up the things that I've been saying here on Freedom and Reason. So let's go back and review some of those things that I've said. So a few days ago, I extrapolated using CDC's epidemiological model from confirmed cases of COVID-19 to show that possibly tens of millions of Americans have been infected by this virus. And I use CDC numbers. They're multiple of 134. And that's the multiple they use based on confirmed cases from clinical and public health authorities. They extrapolate a factor of 134 to come to the number of the the tens of millions of people who've been infected by influenza. So I applied that to COVID-19, and at the time I did that, and this was the day before yesterday, I think, the day before that. In any case, there were 675,243 confirmed cases, 34,562 deaths from COVID-19 at the time. And so the case lethality rate was 5.1%, and that's roughly half the case lethality rate for the flu based on confirmed cases, which ought to shock you, that flu deaths based on the cases, confirmed cases of the flu, are nearly twice as many as those that are based on confirmed cases of COVID-19. But of course, the CDC doesn't use that figure. The government doesn't use that figure. We'd be terrified if they did. But if you apply that same extrapolation, to the COVID-19 cases, what I came out with was a number of 106 million. All right. Well, that would put the death rate at 0.63% for COVID-19, which is less than the extrapolated death rate for influenza. So in both measures, the death rates are lower. Case fatality rates lower. Epidemiological model shows a lower death rate. But I did emphasize that I felt it was unlikely that 106 million Americans have had or currently have COVID-19. So I considered the standard estimate for asymptomatic and mild or cold-like cases to be about 80%. And then when I used that number, I came to 21 million flu-like illnesses from SARS-CoV-2. And that still seems like a large number. And I noted the implications for the degree of herd immunity that would have, and so forth and so on. Well, now there's a study that uses new tests. These are antibodies tests that can identify people who've been infected and recovered from COVID-19 by searching for coronavirus antibodies in the blood. Excuse me. This is Stanford University, so this isn't from some hack organization. And they tested 3,300 Californians in Santa Clara for antibodies. So it's a very large sample. And the results suggest that the number of people who have been infected is between 50 and 85 times higher than the confirmed case totals. 50 to 85, now not 134 times, right, which is what they do for the flu, 50 to 85 times higher. That's still extraordinary. An expert said that these findings mean that the COVID-19 death rates in the U.S. may be lower than current data suggests. This is from reporting by the Business Insider, and I shared this on Facebook yesterday evening. So I want you to think about this. The number of coronavirus infections in Santa Clara, California may be up to 85 times higher than the testing shows. So now we have a study that shows what I've already told you. The government authorities and reporters did not use the methods the CDC uses for estimating influenza and were therefore way off base. And I was using a very conservative estimate of 10 times the number of confirmed cases. Now, and I said that I used the lowest number I could think. It could possibly be lower than 10 times, given how many people are asymptomatic, have cold-like symptoms, never report. And even people with severe flu-like illnesses don't get tested, don't go to the hospital, and they recover. The last time I checked, there were 706,880 confirmed cases of COVID-19 in the United States. If you take a conservative 50 times figure, take the low end of the range that the Stanford University study found, that's 35.3 million people nationwide who've been infected by this virus. I lowballed 21 million yesterday. Now, I thought my top end projection of 106 million was too high, and so I made that adjustment. But what I now have confidence that I established a range, an appropriate range between 21 million and 106 million, just by applying the CDC's epidemiological technique. Now I'm questioning myself. I used epistemological, because I teach a research methods class, and we're always talking about ontological claims and epistemological claims and methodologies and so forth. Anyway, just you get in the habit of using a term. I talk about epidemiological work a lot, but up until this recent crisis had not been deploying that term very much in conversation. Antibody tests are showing, I want to emphasize this, using confirmed cases as the metric for determining death rates undercounts COVID-19 cases dramatically by many, many times, possibly 50 to 85 times. Tens of millions, almost certainly tens of millions of Americans have been infected by SARS-CoV-2 virus, and the vast majority of them are asymptomatic, cold-like illnesses. Even with flu-like illnesses, most will recover. And the same risk factors for the lethal outcomes in this case are present in the flu, and people were getting on to me early on, don't compare this to the flu. There's this meme I saw where it was ridiculous, where, Godzilla is smashing a city and everybody's like, oh, don't worry about it. Look over here at the flu. And I want to make this point because the Godzilla smashing the city isn't the virus. It's the government response to the virus that's smashing the city, literally. And I'll talk about that in a minute. And so, yes, you compare it to the flu. Because we're talking about how we measure viruses. This isn't Andromeda strain. This isn't something, I love Victor Davis Hanson the other day said something, we're going to whip this thing. We're smarter than a virus. And that's the kind of optimism, but also just sort of objective understanding of where we are and what this is. And the way that you defeat these things is by looking at things like them. The death rates are lower with COVID-19 than influenza. As I've said, whether you measure it by case lethality rates or these epidemiological extrapolations. Quite possibly. On the epidemiological extrapolations, well, okay, influenza 134 times. It's remarkable. So it may be that that using those models, coronavirus is more lethal than influenza, but not nearly at the degree that the public has been led to believe. Not even close. And now we have authorities that are openly admitting to counting deaths that may be from influenza. And even rhinoviruses and other coronaviruses, they cause lower respiratory infections too. I mean, we're talking about pneumonia, all right? And pneumonia has multiple causes. Now they're reporting these as COVID-19 deaths. So they're throwing all of these deaths into the hopper. And the numbers are very dramatic. And you're seeing this, other governments are doing this too. And they have to now justify, this is my thinking about this. It seems to me that they now have to justify why they did such a dramatic thing in shutting down our governments, and with the consequences that we're facing. I mean, people losing their homes, people losing their jobs, people losing their health care. There's anecdotal evidence that domestic violence is on the rise, suicides are on the rise. I'm really worried about the crime piece, knowing that a lot of street crime and violent crime comes from economic material deprivation and structural inequality already, which is exacerbated by these cyclical downturns. What are the consequences going to be there? I don't know if you watch the White House COVID-19 task force briefings. I do, and I started watching them because when I would hear these clips on the media, and then I would go look at the context, and it was like the media is either lying, or they just don't have any understanding of basic scientific reasoning, how these things work. I'm sorry. I mean, I'm not. There are good journalists and there's bad journalists, but as a class of people who are in charge of reporting information, they're not. They don't have a very sophisticated education for that stuff. And they're too busy. Obviously, they're too busy trying to tear down the president. You can see that. But modern journal, I mean, and opinion and news reporting is just completely the difference between those two is collapsed. We're getting real news stories put as opinion pieces, I think, to get them away from the public. But then you have a lot of news stories that are really opinion pieces, and CNN is the worst. It's intolerable. So I started watching these, and I learned a whole lot. So if you watched yesterday's briefing, it was particularly useful in that they presented a map of flu seasons, including the present one. And you can see by the chart this flu-like illness season we're currently in. It's so important for people to understand this. The anomaly in the third spike, usually these are, they rise and they fall, or you'll get a couple of spikes. This season has 3 spikes. It's presumed to be from COVID-19, and that's a reasonable inference. Since the second peak is waning in line with previous flu seasons. I think there's one flu season that came early and declined early. It's kind of odd, but that's neither here nor there. So in this sense, we can talk about deaths above the normal, but that doesn't quite nail it down. Moreover, deaths associated with the curves, when an increasing proportion of lower respiratory diseases are attributed most without confirmation, to one disease or another, that shifts the perception of risk, and so that's an interpretation. It's an interpretation that comes with some I think some ideological underpinnings. Why? Because we're even attributing. I mean, look, a lot of these influenza deaths are estimates. So they could be rhinoviruses. We could actually, they could be masking the fact that rhinoviruses associated with the common cold, which do cause lower respiratory infections, could be masking the fact that that's a significant cause of pneumonia, and it is. In any case, so while the inference is reasonable, it's not confirmed at all, and the previous peaks, the first occurring well before the appearance of SARS-CoV-2, they were quite high. So this has been a bad season for flu-like illness. So I don't see any caution in the way the authorities are reporting this about, since we're attributing COVID-19 cases to pneumonia deaths, they're not ruling out that they're being caused by something else. So my point is that authorities, not without some reason, but also with considerable guesswork, have been attributing SARS-CoV-2 deaths that have no confirmed etiology. And that means that the designation is based on clinical observation or arbitrary categorization by those who compile the numbers. It's not based on actual tests. And the testing is problematic too, as they explained at the press conference yesterday, that you could be tested and you have a negative test, but then tomorrow you could get the virus. So this idea that we have to have widespread testing and then, contact tracing, which involves an incredible degree of surveillance in our lives, that's not going to get us really where we want to be in understanding this. The antibody test is where we're going to be. How many people have an immunity to this disease? And we are finding that we can test antibodies. And it turns out that a whole lot of people have likely already had this disease. Most of them didn't even know it. They got SARS-CoV-2, and they were asymptomatic. So many of the people who die from lower respiratory infection this spring, that are being said to be COVID-19 victims, may very well have had influenza or another coronavirus. The SARS-CoV-2 is one type. There are many types. There's more types of coronaviruses than there are rhinoviruses or influenza viruses. And this is especially true in that second wave, but some even now. And so without testing for much of these, all we can know is that a person's had a flu-like illness or pneumonia without specific attribution. And the honest thing to do would be to report it that way. Because folks aren't reading my blog and they're not listening to my arguments, and that's okay. I'm not a famous person. But I'll get hit when I make comments and other people, because I just see just gross distortions and just fear-mongering and hysteria. And it really troubles me because fear is so limiting to freedom. And then people are scolding other people. And, the level of fear is incredible. And so I sometimes just have to step in and I have to say, this is just not true. You hear all kinds of claims out there. It's not true. And then what I'll do is I'll get hit with the CDC surveillance report on influenza. Because, it's impressive looking, as if I haven't seen it. This is what I've been talking about for days now, weeks now. And they ask me, and it's usually with a great deal of snarkiness, which is irritating, but that's okay. They say, well, now do you want to rethink your position? I even got this today. Rethink your position? I always rethink my positions. That's the way that I work. I get up every day and I rethink my positions. But in this case, I have to say that my rethinking continues to move in the direction that this has been a massive miscalculation on the part of authorities. And they've been aided by the media, which has little or no scientific understanding of such matters. And this miscalculation has not been benign. It's thrown our country into a deep recession. It's depression level calamity. And this is global. And that means that tens of millions of people are suffering. And it's the passivity of the public in the face of fear itself. And I'm just drawing a bit on some echoes of Roosevelt here. You remember that famous line about, the only thing to fear is fear itself. That name, it may not be always true, but in this case, it's true. It's this paralyzing fear and this subservience to government authority that allows this terrible error to continue. It's a self-fulfilling dynamic. And what I tell people is life comes with risk. Freedom comes with risk. You have to stop being so afraid. And you have to stop comparing apples to oranges. Either extrapolate both flu and COVID-19, from the case numbers, extrapolate using, just what's obvious, that most cases are not confirmed, or use case lethality rates for both so that people can understand that flu is probably more deadly, right? Or that if COVID-19 is more deadly than the flu, it's not so much more deadly that we have to shutter society and throw the economy into depression. We're being told that, this is a novel virus, and that's the reason for the novel situation. It's all being blamed on the virus, as if the societal response to the virus isn't what's at issue here. Pneumonia deaths, whether they're from coronaviruses, influenza viruses, rhinoviruses, it's not a novel event. Coronaviruses, I've said this before, they're the viral mix every season. Scientists estimate between 5 to 15% of cold-like and flu-like illnesses are caused by coronaviruses. They've killed lots of people before. And it's because we're not testing for them, we don't know how many people they've killed before. But it's a number significantly greater than zero. And for all of these viruses we're talking about, the vast majority of people recover and go on with their lives. This time, and this is the point, the lives we're supposed to be going on with are greatly diminished by lockdown, by social distancing. So what is novel about this situation is the reaction of the government. Why has the government responded this way? Now, maybe they got it wrong in the beginning. They freaked out. But I'm serious. I mean, from the very beginning, this is what I was saying. First, and friends and relatives, before we shut down school, people were asking me about this. During the spring semester here, we shut down before spring break. After that, we shut down. In fact, Tony Evers has just extended the lockdown for no reason. And we can't, and then schools, and even though he's going to reopen, I think late in May, schools can't reopen, which is just ruined this. It's so important for our kids to get an education, to be in school, to be around other kids. So they got it. So either they got it terribly wrong, so that they could pull all this crazy surveillance shit off of the shelf, and be able to gain extraordinary police powers, and now they got the public agreeing that they should suppress First Amendment rights. It's unreal, or either they're just incompetent, and then you're going to have to really think about if you're going to trust your health to a government that's so incompetent. What has also been exposed by this is the inadequacy of the medical industrial complex. This Fordist just-in-time production method of not having enough things on hand. And you should think about all the people who won't get, had to postpone their elective, surgery, right? Because you have elective surgery. That's it. You get to choose when you go in. It's not an emergency. Who've had their surgeries postponed. Think of all the colonoscopies and when you have surveillance of your esophagus. This is serious. This is something I have Barrett's esophagus, and I was in a terrible state, and I had treatments that were developed by Mayo Clinic. And I happened to have a good doctor who was a scientist. I said, yes, try it out on me. And to great effects. But had I been going through that crisis right now, I would not have been able, quite likely, that I would not have been able to access. And I would have developed, I was right at the point where it was developing into esophageal cancer, which is a terrifying cancer to get. How many people are going to get, their situation is going to develop in a way that will ultimately kill them? That earlier detection, that earlier treatment could have helped. It's just bizarre. It really is bizarre. These are the things that people need to question, and it's astonishing to see the public cowering in the face of a virus. And a lot of you who will watch this will have been among the people who were cowering from the virus, and you'll be offended by the things I say. Well, I'm routinely offended by the things that you say. I'm offended by the fact that people would roll over so easily for this. I'm offended when I'm attacked for criticizing the response. We cannot live our lives if we become en masse pathologically afraid of death, because that means that we are pathologically afraid of life.